29. Welcome, everyone. My name is Patrick Hanaway. I am a board-certified family physician. I'm the Chief Medical Officer at Genova Diagnostics, and I'm a clinician. I've been working in the area of integrative medicine, holistic medicine, regenerative medicine, functional medicine, anti-aging medicine, metabolic medicine. Sounds like a lot of things, doesn't it? It's all the same thing. Really, it's good medicine. It's how we can learn to be able to understand how to take the tools of science and to be able to apply them, but not apply them in a way that is specifically focused on trying to minimize the symptoms of disease, but rather to look at the root cause and go upstream to understand what is leading to this imbalance in the first place. So I have the great opportunity to be able to speak with you in Module 3, in Module 1, in Module 7, in Module 9, Module 14. I think that's as high as we are right now. But my perspective, and over the past 10 years I've had the opportunity to be able to go around the country and teach to doctors and clinicians about some of the tools that I've learned in practice and some of the tools that are now available to help us really understand what's going on underlying with the root cause of disease, imbalance, and illness, to help move people towards that continuum of health and well-being. Over the next 4 hours this morning, we're going to focus on what the role of the gut is in relationship to that. We're going to learn some important concepts, and I'm going to highlight a simple little 3-letter acronym that I'm going to come back to time and again. D-I-G, dig. I'm going to help you to understand the issues of digestion, what their role is in the ability of our body to be able to assimilate the 35 to 50 tons of macronutrients and micronutrients that we take in during our lifetime. If our digestive process isn't working properly, digestion and absorption, we're not going to be able to utilize and bring into each of our cells those macronutrients and micronutrients that can help to bring us back to balance. We're going to talk about I. I has multiple meanings. Actually, it's kind of a triple I. We're going to talk about the immune system, as the gut is the home of the immune system. 70% of all your immunologic cells are based in the gut. We're going to talk about intestinal permeability, that structural barrier that allows us to be able to discriminate. In Chinese medicine, traditional Chinese medicine, the 2 meridian, the small intestine meridian, is that which is responsible for discernment, for separating wheat from chaff. The intestinal barrier and intestinal permeability is going to be an important part of that process, and also about infection, the 3rd eye. And we're also going to talk about the gut flora, the gut microflora, which have more detoxification capacity than our liver. We have 100 trillion bacteria living in our gut, but only 10 trillion cells in our body. So it gives you a perspective that it's something important that we should pay attention to, if not something greater than that. So that DIG is something that I'm going to emphasize through the time this morning. And we'll go into a lot more detail on that. And then tomorrow morning will be a little more case-focused. Okay, so he gave us a whole bunch of information. There's a few cases sprinkled in this morning. And then tomorrow we'll say, okay, so patient comes in. What do I do? How do I approach this? How do I understand this? I'll be around all day today. I'll be lecturing this morning, be available at the breaks for questions that people have. I'll be available this afternoon and this evening as well. I'll be teaching next door on inflammation and obesity a little bit this afternoon, and then again back tomorrow morning. So if you have questions for me, please don't hesitate to stop me. I have one simple request, and that is don't follow me into the bathroom with questions. It has happened. Without further ado, let me see if my clicker is working. Okay, it is. My experience when I was in medical school, I trained at Washington University in the mid-'80s, and then went on to residency training in family medicine at the University of New Mexico. have had a great opportunity to be able to work in some unique areas of the world, from the Himalayas in Sikkim at a Tibetan monastery to western Alaska, where I lived for 2 years on the Bering Sea, to rural New Mexico, and was on faculty at the University of New Mexico, and do regular work down in the Sierra Madres in Mexico as well at this time. So I've seen a wide variety of illness and wellness. And in that, what I found when I finally had the courage 12, 13, 14 now years ago to hang up a shingle saying, this is all that I'm doing, is a holistic, integrative, functional, anti-aging medicine. What happened to me at that point in time is I had a wide variety of experience and some skill sets and a knowledge of nutrition and osteopathy and stress reduction and all these kinds of things. And what I found was, and herbology, and when people came into our practice, many of them had already tried many of the things I had in my toolkit. And so well, where do I go now? What do I do to really get a better understanding of the root cause of what's happening for this person? Because we're not talking about green medicine, so to speak. We're not talking about, well, instead of giving you an antibiotic, I'm just going to give you an antimicrobial herb. That doesn't help get to the root cause of what's going on. And what I found, what I learned in that process, now about 14 years ago, is that when I started taking care of someone's gut, their ability to assimilate the materials that they're taking in, to digest and absorb the foods, to deal with issues of intestinal permeability and infection, to balance their gut flora, they started getting better. And it didn't matter if we were talking about irritable bowel syndrome or interstitial cystitis or chronic fatigue or depression or fibromyalgia, that as soon as I started to help their gut to get back into balance, to be able to assimilate the nutrients they were taking in, they started getting better. Within 4 to 6 weeks, they started getting better. And it's not the totality of what I do, but it's the first thing that I do. Someone's coming in and they've got perimenopausal symptoms. I generally want to make sure that their gut is doing okay before I start to deal with hormones. This is my perspective. That's why they have me talking about the gut. But I find that it makes an incredible difference in the process and has helped my patients and helped, I was going to say more importantly, equally importantly, my practice, my ability to be able to bring these tools to move people towards health and well-being. So that's what I'm here to talk about today, and I'm going to ask each of you to begin to consider the gut, to mind the gut, to see how it is as a tool that I can use. So it does not matter if you're a family doc or an internist or an OBGYN or a pediatrician or a surgeon or a physiatrist or an ophthalmologist or whatever kind of background you have, helping to bring the gut into balance is important because it has implications not only in those GI-related illnesses. 20% of the patients we see coming in are going to have irritable bowel syndrome. 32% of the people we see, or I'm sorry, 16% of the people we see coming in are going to have GERD, are going to have reflux symptoms that are going on. We want to be able to help those. But we also know that currently 24 million people in the country, and it's estimated that there's another 42 million who already have autoimmune diseases going on. And we'll see and talk a little bit about how autoimmune disease relates to, and in fact has imbalances in the gut as one of its root causes. Because when there's intestinal permeability, that is a necessary precursor to the development of autoimmune diseases. And when we can take care of that, we can work to bring things back into balance. And speaking of that intestinal permeability, we know that stressors are going to have an impact on intestinal permeability. So when we look overall at the big picture, we have to consider how do we help our patients deal with stress? How do we help them to have the right nutrients? And one of the things for some of you who have heard me speak before, I see some old friends in the crowd here. What's emerged for me in the past really 5 years especially, is understanding the root of stress reduction and nutrition in helping to bring balance to all the systems in the body. So I'll sprinkle those ideas throughout the conversation today.